So I'm the lead for public health for Slough Borough Council, and I've just got a short, fairly short talk about why I'm involved and why my team is involved in tackling social isolation and encouraging belonging. And that's because we've talked, and it's been talked about already, about some of the health impacts and the impact on physical, mental, social and emotional well-being. So, really important. And we recognise that the issue is growing. So, in my talk, I'm going to talk about the launch of a new information resource, because public health often produces information and data which then can be used by charities if they're writing business cases and bids, and about general awareness so that we can make sure that we're offering the right things to match what people need. I'll be talking about some of the key messages that come out of that information, what we can do about it, and then also looking at how public health and other community team within the council can continue this conversation with the faith communities for the betterment really of Slough's health and wellbeing. So we are just launching this new report. It is quite detailed, so it's not necessarily everyone's going to be everyone's cup of tea. It will be on our website, and it is actually today. We just had one last few things about the data that we just wanted to check up before we published it, but it is available now on our website in the campaign section. And we're very grateful to Lizzie Blundell and the team, the Public Health Shared team for Berkshire, who produced this report. We have some printed copies today for those that find that a bit easier. But I'll talk through some of the key elements, the key findings. So what we see is that at last, I think there is a growing national awareness of social isolation and its impact and the need for action. And I think there was work that was being done, that has been done for many years, but one of the things that was a key catalyst was the Joe Cox Commission on Loneliness. And they called on the government to produce a strategy, to have a measurement, because it's quite tricky sometimes to actually measure social isolation and actually, then follow whether that's having any impact, and also funding from the government. And in the last couple of years, those have all been achieved. The strategy and the guidance, it comes from various sources, and the report goes into that. So the key messages that we see are that it is a common issue, globally and nationally, but particularly in more westernised societies where obviously we do see the rise of social media. We've talked a little about the significant physical, mental and emotional impacts. And the thing about it is we know some of the risk factors, and our speakers today have already alluded to many of them. And public health in particular, part of our approach is to understand what are the risk factors and who are the groups most affected. Because if we know those things, then surely we can work together and start tackling them. And the other thing is we have growing information to help us tackle it. So what can we do about it? Well, the evidence and the resource flags, and I think the expression of one size doesn't fit all is really key. And that's where actually the diversity of our faith communities really comes in. You know your people, and you know some of the challenges, and you can therefore tailor some of the interventions, some of the things that you do accordingly. I think it's really important about reducing stigma, and the evidence shows us that group activities, particularly ones based around the arts, so that's fantastic, educational or a social focus. And we heard from our speakers today, particularly Martin, particularly talking about the baking group. It wasn't about the scones, it was about the act of working together to produce this. The evidence points to us we need to be a bit careful about one-to-one activities and however well-meant befriending can be, and it is important. It's one tool that that group activities actually can be sort of more effective. And the importance of recognising that while technology can be useful, it doesn't replace human relationship. And that earlier intervention happening early in people's lives stops it accumulating, because I think often the stereotype is it's about just older people, but we know that actually younger people, children, are suffering it. So I talked about the opportunity presented by today, the fact that we're all here together, and while we're talking about social isolation, I just wanted to flag briefly that there are other health challenges that I think the faith communities we could all work together to help tackle. You already have shared beliefs and trusting relationships. You already have existing networks that are probably already doing good, many of the things that have been talked about, sharing food, sharing meals together, companionship, a number of other activities. And it may be also that some of the members of your different faith communities do share some different health beliefs, health challenges in common, which may be related to common heritage. And so my challenge, I suppose, as the lead for public health for Slough, is could we develop on this and develop some sort of movement, fit and faithful, and just an idea. It's something that we will follow up on. So I just want to advertise our new website. We've talked about a number of different issues. We've talked about mental health. We've talked about other health issues such as heart disease and stroke and some of the other things which are risk factors. And this website here hopefully will offer some really helpful resources, practical resources for you in Slough about the offer that we have, the different services available. It will click you through to pretty much anything, and we're always building it to help people work out what's going on in Slough. That will help, whether it's dealing specifically with social isolation and belonging and loneliness, or whether it's other factors that you would like to address. The last thing I'll say before we close is we talk about the 5 ways to well-being, which I always struggle to remember all 5 of them. It's the give, connect, learn, be active and take notice. And I was thinking about that. What is it that faith communities do that address that? Well, clearly I think all the major religions and faiths give. They give of time, give of money, and give of companionship. You all connect in different ways. You often are learning, sometimes quite purposely, through learning about scripture together, whatever your scripture is. And you're often incredibly active, whether it's some of the practical stuff like helping a neighbour with a specific task, or cleaning around the place of faith, or gardening and that sort of thing. And these are all great for kind of, I suppose, team activities, but also physical well-being. And through different forms of prayer, we take notice. So just in being part of a faith community, we are already part of those ways to well-being.